Welcome to Dental Work-Life Balance Live. My name's Audie Cashin, and I'm your moderator and also host, and if you allow me to be, your coach. So Dr. Bill Claytor has been passionate about perfectionism and what it does in dentistry. Is it your friend or is it your foe? And so today we're going to talk a little bit about what that looks like, and I'd love for everybody to use the chat feature to go asking questions and putting questions that you might have for Bill. And then what we'll do at the end is have question and answer. So if you could drop those in the chat, I'll collect all those things. And then what we'll do is have a question and answer at the end, about 10 minutes. And if you want to stay a little bit longer, we can do that as well. But we're going to finish at the top of the hour, just like we've promised. So Bill, what I love about Bill is he's committed at the highest level. He's done for the ADA and also for North Carolina, working and helping dentists with basically everything around well-being, from substance abuse to, the different things that he talks about in so many different CE courses, as well as he has his own personal story of burnout, which I didn't know. So he's going to be able to share with us tonight. And Bill, I'll let you take it over from here.
Thank you so much, and welcome everyone. Yes, and so we'll just kind of go over a few things here, and then take some Q&A. And Audie, if you have any questions, interrupt. If you get anything in the chat box, definitely. But I want to start out by saying, the title tonight, Perfectionism, Friend or Foe. I think it's okay for it to be both. It can be your friend, and it can also be your foe. And when it's your foe, it could be indicating maybe a need for change and to look at yourself in a different way. So let's look at what perfectionism is. I'm sure we all have an idea of what this is, but I like to think of perfectionism as a spiritual condition. It's really, if you feel like you have to be perfect in every way, it's really a denial of your own humanity. And that's from a friend of mine down in Georgia who takes care of a lot of dentists and hygienists in the state that deal with this and other mental health problems. But we've all seen pictures or things like this in our lives that kind of, drive us crazy. I don't know about you, but I just want to go and move those three black little tiles back a little bit and add a couple more, or maybe one or two more in there, so everything will be perfect. And so the question is, will it really be perfect after I do that? Well, perfectionism can be a good and a bad thing in your practice. I think there's a healthy perfectionism, and there's also a paralyzing, I like to call it, perfectionism. And we see it manifest in a lot of ways: stress, increased anxiety, higher levels of burnout potential, and problems delegating. Some dentists have really hard issues, or difficulty, I should say, with delegating to staff members that might help them to practice with less stress and with more confidence. In other words, they feel like they have to control every detail. We can become overly critical or judgmental in our whole lives in so many different ways, and not only in our personal lives, but in our dental world, our dentistry that we do. Micromanaging is a big issue with perfectionism, and continually overworking and overworking and overworking to do it over and over and over to get it perfectly. And oftentimes this can manifest itself into being less productive. We deal with a lot of things, from mistakes, high standards, expectations of self and others, criticism from others, and we get real antsy when we don't know everything about what's going to happen. We have that fear of the unknown, fear of loss of control, not getting something that we think we need, or losing something maybe that we have. And so I raise the question: is not knowing everything about a subject or a situation, or not being perfect, really a sign of weakness and vulnerability? Or could it be possibly an opportunity for growth? And that's what I want to strive home the point, that opportunity for growth is really what being imperfect is about. And that's the human condition, as we all know. We always have these different behaviors, from not wanting to do things, and so we procrastinate because we know we won't do it perfectly, or we get in cycles of obsessiveness and compulsiveness, redoing things, avoiding trying new things. And so we can become literally paralyzed mentally and physically. I've known people who cannot even leave their house to go to work because they are afraid they're going to make a mistake. And that's quite devastating. As Voltaire said, doing something better is the enemy of good enough. And so we have to come to a reasonable expectation of what the human condition can do and should accept. The perfectionistic model that we talk about, and a lot of the research is around these two components. a person that exhibits excessively high standards, along with being very critical of self and others. So when you pose those two at each other, it can really cause a problem in moving forward a lot of times, in not only our work and our thought, but our mental health. So I'm going to talk to you about the three basic types that we're going to talk about here of perfectionism, especially that dentists deal with. The first one, all these types, they are rooted in our belief systems, our attitudes about conditions, situations, and they're also different issues surrounding each one. So the three that we're going to talk about is the one that is called self-oriented perfectionism, socially oriented perfectionism, and other-oriented perfectionism. And I think we can all relate to all three of those in our own profession. The self-oriented perfectionist is one that says it is the standard that I set for myself for perfectionism is mine and mine alone. Uh, it's not set by anyone else. I have a certain level. I have been with dentists who have been in that I've been talking to at times in person, where they would actually I had one to slam his hand down right on my desk and say, "I must do it perfect, or I will do it over until it is perfect." And he was not joking. He was very, very serious, dead serious about that. And I didn't know how to respond. It was just like, wow. But we get that way sometimes because, and so we think about things like, showing your case before other people. My cosmetic case was not perfect, so I must redo it until it's perfect. We talk to ourselves like that. And the interesting thing about it is we translate that into patient will be satisfied then when it's perfect in my mind. But the reason is, the reality is that a lot of times patients haven't a clue what's good, bad, whatever. They just want to feel comfortable, function, and feel reasonably comfortable, right? And so that's what it's about: aesthetically pleasing, but not perfect. But in our minds, we have a whole set of standards. So this is self-perpetuated. The other type is called socially oriented perfectionism. And this is where you feel that others expect you to be perfect. And so we see a lot of that in dental school, where you think your professor's mad at you or not, thinks you're a slacker or whatever if you're not, making the good grades. And maybe they think I can't do it, but actually you can do it. You just need a little encouragement as you're going along. And this looks like, I would never show my cases, any kind of case, root canal, cosmetic case, to a study club, because I'm sure they could do it better. And besides, they'd be critical of my work, and I don't think I could handle that, because so you're projecting what you think other people think about you. That's part of the codependency. That's part of that codependent relationship a lot of times we have with others and our patients. The third one is other oriented. And I think we can all, if we've never experienced this, I would say that, well, and maybe I can't speak for everyone, but I think a lot of people have thought this. This is where you criticize other dentists' work because it's not up to your standards, not just your standards, but your perfectionistic standards. And a lot of times that is not known, that's based on not knowing what the dentist had to work with, or the conditions he or she had to work under. So that looks like, I'd never performed substandard dental work like this dentist that I see here. And I can't believe how much bad dentistry I've seen in my career. So you're very judgmental. Not that it may be justified, but the point of it is it can be detrimental to your own mental health. So the cohorts that have been done on this from 1989 to 2016, we've seen a trend where perfectionism has been increasing, especially with young people. And we're going to look at the three types of perfectionism and kind of put it in general terms. We've seen this increase where we see this generation now more demanding on themselves. So they have this self-oriented perfectionism, not so much the socially oriented where others expect them to be a certain way, but they project on other people as far as being judgmental, but mostly due to demanding of themselves. And that can be to the detriment of performance a lot of times, especially in a field like we work in. Why is this so? Well, in America, in American, Canadian, and British cultures, we see a lot of what's called hyper-individualism, where it's all about the individual over community. It's about me, myself, and I, and my needs are more important than the greater good. And so it's a very individualistic society, a very materialistic society. And we're also afraid of being attacked on social media. So we call it socially antagonistic society, where we will say things on social media that we would dare not say in person to someone else, but we try to do character assassinations a lot of times with other people on social media. We have more competitive values, more unrealistic expectation, and then an attitude of entitlement in the Western world that they deserve something because of who they are and what they've been through, and then more anxious and controlling parents than previous generations has kind of cultivated this whole atmosphere of this perfectionistic, entitlement kind of attitude. We think in dentistry, black and white, a lot of times thinking it looks like, it's either perfect or it's not perfect. If it's not perfect, it's for those who aren't as good as I am. It's either right or wrong. It's either black or white. We have a lot of that thinking in dentistry. We have catastrophic thinking too. Um, things like I would never ask a colleague for help because it would make me look like I didn't know what I was doing. Asking for help is a big barrier for mental health a lot of times, whether it be something mentally depressive, stress wise, or even procedural wise, clinical wise. Then you look at what's called probability overestimation. That's a type of thinking where you say, even though I'm prepared for this root canal, I'm sure that if it's going to happen, it's going to happen to me, and something won't turn out right. And then you have these should statements like I should never have a paresthesia with a mandibular block because I know I did it right. These should I always these kind of statements can really weigh you down into a very deep place. And so we have to be careful when we start thinking like this. And I'm going to show you some areas of how we can, as I call it, productive thinking and productive perfectionism. So when we look at perfectionism, we talk about the two major types that are researched, concerns and striving. So perfectionistic concerns are usually associated with unhealthy or lead to unhealthy behaviors or can be associated with unhealthy behaviors, which can actually increase the chance of burnout. And strivings are usually associated with healthy behaviors, which mitigate the chances of burnout. But when we look at perfectionistic concerns, usually our standards are unreasonable and unreachable. We have perfectionism as the only way that you go forward if it's not perfect. And again, I always say perfectionism is like a football team. If you're on the 10-yard line and you perpetually or into perpetuity, whatever you want to say, the defense always gets a 5-yard penalty and it's always half the distance to the goal line. You never get there. I don't care how long you live. You're never going to do anything perfect. We all say that, but our actions oftentimes are self-defeating because we won't accept it. So accepting imperfection is a big step to overcoming perfectionistic concerns. So perfectionism is the only way. If you have a failure, you're a bad person. You become defensive. You're like as I was telling Audie earlier, you're like a puppy. You want to be stroked. You want to be petted to say you're a good dentist. You're doing well. Everybody, you want people to praise you all the time. But if you don't get that and you have a failure, you become very catastrophic in your thinking. You take everything to the nth degree. It's going to turn out the worst possible scenario. Mistakes are looked at not only as I did something bad, but worse. And this is the really worst part of being having a predominance of perfectionistic concerns is that I'm an unworthy person or I am a bad person. And you say, who would say that? Trust me, it happens and people uh, implode, if you will, with that emotional stress. And then the actions, oftentimes, we procrastinate and we become paralyzed, as you've heard me say. We won't take on new techniques. We won't try maybe 3D technology or CAD CAM, or we won't try changing our AR system. We become paralyzed. We won't go forward because we're so disengaged from our practices. On the other hand, like I say, if the control, I mean, the concern side is greater than the striving side, and we all have a little bit of both of these uh, perfectionistic concerns and perfectionistic strivings. But if the concerns are greater than the strivings, it can become destructive and often are associated with poor coping habits because no one's ever been taught how to deal with some of these things. You kind of learn it through life's lessons, but No one tells you how to deal with an irate patient or what you do if something goes wrong. I mean, you just kind of make your own way. And so you don't come out of the womb knowing this stuff is my point. And as you've seen here, when you have the fear of not getting what you think you want, or somebody's going to take something from you, or I'm going to make a mistake, you become paralyzed and you procrastinate. And so that's that side of perfectionistic thinking. On the other side, perfectionistic strivings, you have reasonable standards and reasonable goals. If you don't know what those are, talk to your colleagues that you like the way they practice and say, how did you achieve where you are today? How did you get to this point? Tell me what steps you took. Who did you consult with? You look at perfection as not a reachable possibility, but you learn to accept a certain degree of imperfection. And that's very hard for all of us. I know. Bounce back quickly when you have failures. Look at them as learning experience. Criticism, you be open to healthy, constructive criticism and look at it as what can I do next time differently if this happens again, and learn from your mistakes. And you see mistakes not as a negative thing about you being a bad person, but it's an opportunity for you to get better. And that's really what life's about, whether it's dentistry or just living, right? And our actions oftentimes just remaining open to criticism, remaining humble and teachable to new concepts and new ideas are so important. So when strivings are greater than concerns, it tends to be a motivator in practice, and people have less. It says no burnout, but I think a better word there is it tends to mitigate burnout potential. So you have better coping skills because you're learning how to accept yourself as not being perfect. Vince Lombardi, a lot of you remember from days gone past, used to tell his players, go out and we're going to chase perfectionism every time we are out on that field. But hopefully along the way, we will realize excellence. And that is so important. And that's what I hope we can learn and accept and realize in dentistry. And so I say in dentistry is what we do. Is it perfect? Really? Why don't you place implants? I've heard dentists say, I don't place implants because oral surgeons can do them better, and they place them perfectly. Well, news alert: oral surgeons don't place them perfectly. And I'm not against oral surgeons. That they're wonderful people, but nobody places them perfectly. Why do you do crowns? If that's an acceptable procedure you do in your office, why would you do a crown? Are they perfect? What is clinically acceptable versus what is perfect? You're never going to accept a perfect crown. You're only going to do a clinically acceptable. At what level do you say that's clinically acceptable? So you have to accept imperfection. Hygienist, you sit down and check the hygienist after they get through the procedures. Do they remove 100% of the plaque buildup, biofilm, on and on? No, of course not. But you approve it and you say, good job, it looks great. Is it perfect? No. And why don't you do root canals? I've had dentists say, I don't do root canals because I'm afraid I won't find all the canals. Well, endodontists don't either. And it's amazing that when you take everything in factor everything in, teeth that don't have all the canals are filled sometimes do fine. I mean, I'm not advocating not finding canals, not filling canals you can fill, but it's impossible. It's not a human task that we can do all the time.